you're probably not treating your cuts or scrapes the right way. Improper care could lead to worse scarring and slower healing. I'm Dr. Tania Elliott, board certified internal medicine specialist and allergist, and today I'm going to show you the proper way to care for cuts and scrapes to minimize scarring and shorten your healing time. Picture this, your kid just fell off their bicycle, they scraped their elbow, they scraped their knee. What do? You bring them inside, you clean it off well, and then you probably just let it air out to heal, right? Wrong. Letting cuts and scrapes air out actually delays healing and worsens scars. Here's how you should actually care for a cut or scrape to minimize scarring and shorten healing time. First, you're going to irrigate it. You can take some water and flush out the scrape so that you don't see any debris or dirt or anything like that in there. Ideally, you'd want to use distilled water, which you can buy at the pharmacy, or previously boiled water to get rid of any potential contaminants. So take a pot of hot water, bring it to a boil, let it cool down a little bit to warm, and then you can use that. However, if you're in a rush, using tap water is okay. But I would not recommend using bottled water in any case scenario. And that's because there are microplastics that could be present in there, as well as contamination with bacteria. So this step is called irrigation. You really want to flush out the scrape or the wound, again, to make sure there isn't any dirt or debris or rocks or anything stuck in there. So more is better. Next, you can pat it dry with a cloth, or better yet, just a piece of gauze. Then you want to apply an ointment, but not Neosporin. Neosporin is an antibiotic ointment. Most cuts are not infected in the first place, so you only want to use an antibiotic ointment if it's showing signs of infection. And we'll get back to what those signs of infections are a little bit later in this video. So apply an ointment, ideally something that is a barrier ointment, so something thick like Vaseline. The reason for this is that cuts and scrapes need moisture to heal. So once you've irrigated it with water, you now want to seal and lock that moisture in with a barrier ointment. Then you can put a Band-Aid on it to keep it covered. Remember, you do not want to air it out because that will dry it out, and drying it out will actually slow the healing process. Remember, cuts and scrapes need moisture to heal. An alternative to a Band-Aid, because sometimes people actually have reactions to adhesive, is to just take a piece of gauze and paper tape. Now you want to make sure that you change this bandage daily, and again, ideally keeping the cut moisturized. So every day you're going to want to repeat this process. Wash it out, pat dry, apply the barrier ointment, and then put on a Band-Aid or gauze and paper tape covering. If you're finding these tips helpful, please support my channel by clicking that subscribe button. Okay, let's get back to it. So following these steps every day may seem annoying, but it's going to minimize your chances of scarring. What you don't want is a giant, dry, crusted thing that then you tend to pick at. And if you do end up with some crusting, please do not pick off the scab because that's going to make the scarring worse. But ideally, if you're following these steps, you won't even end up with a crusted scab at all. Now, let's talk about the signs and symptoms of infection. If the wound after a couple of days is not showing improvement, meaning that the margins of the wound, the outline of the wound, is not getting smaller, but instead is getting larger, if you're seeing redness around the area, if you're seeing pus coming out of the area, if it feels tender to the touch, those are all signs of a localized infection. Now, if you start to have aches or pains in your body or fever, that's another sign that there could be a bacterial infection happening. One thing you can do if you're not sure is actually just take a marker and draw a line around the outside of the skin where the cut stops. If you're noticing within an hour or a day that the redness is actually growing outside of where you've drawn the line, that's a sign of an infection. In these cases, you may benefit from a topical prescription antibiotic or an oral prescription antibiotic, but that's the time to go ahead and see your doctor. There is no evidence to support what we call prophylactic antibiotics, meaning taking an antibiotic or putting on a topical antibiotic just in case, because most cuts or scrapes do not turn into an infection. Studies have shown that using a barrier ointment like Vaseline can actually improve the time to healing and reduce the risk of scarring compared to wounds that have not been treated with Vaseline. So in conclusion, to recap, proper wound care involves washing out the cut, applying a barrier ointment like Vaseline, covering the cut with paper tape and gauze or a Band-Aid, and repeating this process daily until the wound is healed. If you have a cut or scrape, give this method a try and see the difference. Remember, proper wound care can make all the difference. You do not want to have a big giant scab. That means the wound is not healing properly. Thanks for watching, and don't forget to go ahead and click that subscribe button to get more health tips. See you in the next video.